Well, hello everyone. Good afternoon. So, welcome to the session of pharmacology. I hope you guys have logged in. Audio and video, everything okay? All right. So, I'm seeing your comments. Let's start. Okay. All good to go. Fine. So, as you all know, sir, we are going to discuss important topics. The language of the questions may not be necessarily same in the exam, what will come from this. But so far, God has been very kind. If you have watched my previous videos and if you have watched the recalls of the exam that has come right after that, many questions have actually turned up from our 25 important questions. So do not just read the question, obviously, what I'm sharing here. Do read the topic. Okay. And I'm sure you guys are already following the timetable that I have sent you guys. Little by little, every day, if you keep studying pharmacology, then you will be a master of it. If not, at least, the exam becomes manageable. Fine. So anyway, without any further ado, let's begin. Okay. Here you go. The first question. A 66-year-old man who is known case of BPH has aggravations of symptoms. He has been a chronic smoker. His case file reveals that spirometry was performed and FEV1 over FVC ratio is reduced. So he was put on the respective drugs. Which of the following drugs is he most likely on that may have caused the presentation? Okay. So expect this kind of questions like the twisting of language, etc. that can be here. All right. Fine. So I guess you guys are ready with your answers. If you follow this question, you're just going to have one single minute in your exam, as you know, especially now that the questions are going to be divided into, 50-50 questions block. So you need to get a good practice of answering the MCQs a bit more faster now. Okay? So now the discussion of this question. Sabse pehle, what is the question asking? Too many things being mentioned in the question. Sir, they just said that a patient is having BPH. Fine. And now his symptoms has aggravated. That means they have become more severe. BPH presents with urinary retention. That means that urinary retention is now more exaggerated. So the question is why? Because if you notice in the next parts of the question, I've given you some hints that in this person, first of all, he is a smoker, and then this ratio is reduced. Related to your pulmonology, you all must be knowing that there are two types of diseases in pulmo. One is obstructive diseases, another is restrictive diseases. So what happens is this ratio is reduced when it comes to obstructive disease. He is a smoker. What disease is coming into our head most likely by now? Okay, this disease must be something called COPD. This is a case of COPD. So what drugs are given for COPD? You must know they are bronchodilators. There are two types of bronchodilators. One bronchodilator is beta-2 stimulators called SABA-LABA. Example, salbutamol, which is good in asthmatics. Okay. And the second one is ipratropium, tiotropium type of drugs. They are better in COPD. So here the person must be on the tropium drugs. Sir, all of these drugs are used in asthmatics. Okay, there is no doubt about it. First of all, this is a COPD patient because smoker hint and the FEV1 and FVC ratio. So, Sir ji, tiotropium, How does this drug work? The drug called as tiotropium. This drug is a muscarinic blocker. Okay, tiotropium, it is nothing but a muscarinic blocker. So if you block muscarinic receptors, you all must be knowing parasympathetic system is blocked. And if parasympathetic system is blocked, the presentation will be reduction in the urination. So that's what happened. The patient of BPH came with the symptom. Which symptom? Urinary retention, because those are the problems of BPH. Why did it get enhanced? Because the doctor may have made a mistake putting the person on a drug called tropium, which will further reduce urination. That's it. So this case scenario, you must all remember, doctors. All right. Apart from this, Montelukast, formoterol is nothing but salbutamol-like drugs, salbutamol, salmeterol, etc. Theophylline is a oral bronchodilator. Okay, so technically we are just saying that in this case scenario, the correct answer will be tropium. All right, sir. Next, let's move on to the second case scenario. A 68-year-old male complains that he needs to urinate frequently, usually voiding only small amount of urine with each episode. And there is sensation of imminent loss of urine without control. Investigations reveal PSA levels of 9 nanograms per milliliter. Which of the following alpha blocker used in the treatment of BPH does not produce hypotension? Fine. So let's go with our next, question. Dr. Saab, first of all, there is a hint that is given. PSA levels are mentioned. You must all be knowing already that PSA levels are used for diagnosing something like prostate cancer or BPH. It's related to prostate specific antigen. Yes or no? They are increased, as you can see. So most likely a case of BPH. Now they are asking which of the alpha blockers used in the treatment of BPH does not produce hypotension. So actual question is hidden here only. This is the main question. Baki sab, even if you read, even if you didn't read, does not matter. So questions can be like this. That's why always I advise during my classes also, read the last 1 or 2 lines quickly, so that maybe sometimes the direct question is from that last 2 lines, or sometimes you will get a hint at least like what to read in the upper lines. Your brain is already having a direction to look at. So that's it. अब ये question इतना ही है कि which drug does not produce hypotension from this? Sir, the correct answer to this is going to be Sildosin. Sildosin. Technically, all the 4 drugs I have given in the options are used in BPH. Okay. For example, if you know these medicines called Zosins, Zosin type of drugs are alpha 1 blockers. Alpha 1 blockers. And when I say alpha 1, you must understand there are 2 types of receptor, alpha 1A and alpha 1B. Both are getting blocked. Because of alpha 1A blockade, I am getting to treat BPH. This becomes treatment of BPH. All right, because it causes urethra dilation. And because of blockade of the subtype B receptor, you have to remember B for blood vessel. That's where these receptors are present. B receptors are on the blood vessel. Blocking this receptor will produce vasodilation. Okay, blocking this receptor is going to produce vasodilation. And what does vasodilation do? Reduce BP, that is hypotension. So technically this drug and this drug will produce hypotension. Okay. Now, next thing is this. You have a drug called dutasteride. Some of you will argue, sir, dutasteride also may not cause hypotension. Why are you choosing the answer as Sildosin? Please pay attention. In the question, I have clearly mentioned alpha blocker. Dutasteride or finasteride are not alpha blockers. What are these medicines? Dutasteride is nothing but 5 alpha reductase inhibitor. 5 alpha reductase inhibitor. What do the steroid drugs do? They reduce the size of prostate. But reduction of the size of prostate will take at least few months. That means even if you start finasteride, dutasteride to treat BPH, effect doesn't show right away. It takes few months. So in that period, few months, the patient obviously is very uncomfortable due to urinary retention. What do people want? People want everything fast. Okay, everything needs to be fast. So that's where the drug of choice for BPH is not finasteride, dutasteride. Although they do the main thing, they reduce the size of prostate, they're not the drug of choice. Drug of choice is the drug like tamsulosin and its cousin sildosin. Drug of choice is tamsulosin only. Same like tamsulosin, there is one more drug called sildosin. I don't want a surprise factor in exam. Dr. Saab, you all must know that tamsulosin is a drug memorized by most of you. Halaki, there is a cousin of that called sildosin. What if they give you this one in the option? I'm getting you ready for that. So sildosin is a alpha 1A blocker. It does not work on the blood vessel. It does not produce the hypotension. Hence, these drugs like sildosin and tamsulosin are only used for a disease called BPH. Chalo, let's wind up. Zosins are for BPH and hypertension treatment because they produce 2 effects. And the tamsulosin, sildosin drugs are only for the BPH. Finasteride also used in BPH, but it's not a vasodilator. It is the drug that reduces the size of prostate. Okay, hope you guys got this correct. Okay, so your time starts now. Fine. Now, a patient with history of hypertension, DM type 2, hypercholesterolemia, and asthma presented with the condition shown in the image below. Which of the following can be used in the management of the condition that the patient is suffering from? All right. So I know that majority of you are going to give one answer, which is going to be wrong. I know the student's mind. That's why I'm getting you ready for the real exam. Okay? I'm sure majority of you have answered omalizumab, which is a wrong answer. Okay? I'm in your brain. So doctor, please check this out. Omalizumab is a wrong answer. First of all, coming to the point, omalizumab, why is it a wrong answer? Because this drug, it is going to block something called IgE. You must be knowing from your patho and micro that IgE antibody is involved in type 1 hypersensitivity, that is asthma. So agar aapko asthma rokna hai, if you want to stop asthma, then omalizumab is given. Question did not ask you this. There is a big image given. Asthma mein do you see this thing? Of course no, the question is not asking that. The question asks condition that the patient is suffering from. ठीक है, बात समझ में आई है? That's why this is the idea. Now, omalizumab is the wrong answer. It is used in asthma. That's not what I was asking. Next, trastuzumab. Sir, अब एक एक की hint लेते जाते हैं. Sir, what is asthma hypersensitivity? The disease is having too much immune reaction. What do you want to do in the treatment if too much is the problem? Reduce the immunity. And for reducing the immunity, we are blocking what? IgE. IgE, if you block, none of the reactions in type 1 will happen. Simple. It's lowering immunity, yes or no? That's what I want to do in asthma. That's what is seen in the name of this drug. LI matlab lowers immunity. Lowers immunity. Next one. Trastuzumab. Trastuzumab. This drug has a TU in the name. Any MAB having TU in the name is used for a treatment of a tumor. It's used for the treatment of a tumor. Dr. Saab, you got to remember this drug block something called HER2/neu. Okay, this is going to block HER2/neu, and this thing is involved in breast cancer. HER2/neu overexpression is seen in breast cancer, so we are blocking that HER2/neu. So HER2/neu blocker is called trastuzumab, which is used in the breast cancer. So TU matlab tumor, LI matlab lowers immunity. Next one is denosumab. Denosumab is having OS in the name. OS stands for osteoporosis. OS stands for osteoporosis. It blocks a thing called as rank ligand. If you block this, this will be helpful in the osteoporosis treatment. Last bacha ek option, the correct option is evolocumab. Evolocumab. Please remember, lowers cholesterol. LO matlab lowers, C for cholesterol. This is the drug that lowers cholesterol. Evolocumab or alirocumab. These are monoclonal antibodies called PCSK9 inhibitors. Okay, PCSK9 inhibitors. These drugs are also there in our notes. It's not like I'm introducing you to new things right now. PCSK9 inhibitors, these are very great drugs, but quite expensive. Almost, these things may cost 20,000 rupees and above. All right, quite expensive drugs, but very, very effective drugs. PCSK9 inhibitors are newer treatments for controlling the cholesterol. Sir, now I want you to just pay attention. The bad cholesterol called LDL, if you want to reduce, the best medicines are called as statins. HMG-CoA reductase inhibitors. Yes or no? Statins. Sir, if your aim is to increase the good cholesterol called HDL, then there is a vitamin called niacin you got to know. All right. And then if your aim is to reduce something called triglycerides, then the best medicines are called as fibrates. They're called by the name of fibrates. So just at least keep these things in your mind. Which drug is better for what? LDL ke liye statins are better, HDL niacin, and then triglycerides fibrates. So that's it. One question, new type of a question. I'm just asking you to get oriented to. All right. Sir, the main reason we are not doing these questions just to feel better. Please remember, we are here to learn. This is your practice net. Let's make mistakes, whatever it is, but let's learn before the day of exam. Until the day of exam, you are the winner. Remember this. On the day of exam, you are the player. You are going to play on that day, play well in the net. Then you will definitely rock on the day of exam. All right. Next, a 62-year-old patient presents with a seizure. He also complains of visual disturbances, headache, and vomiting. Physical exam reveals pain in the neck. LP was performed and the reports are awaited. Apart from the empirical antibiotics, another drug was started. What is the site of action of the drug that is used in the treatment? Okay, so here we go. First of all, you guys should be able to know what exactly are we diagnosing over here. ठीक है? Do you know, like, सबसे पहले तो seizure आ गया. Seizure means something to do with brain, ना? इतना तो you must have figured, right? Seizure is there, something to do with brain. He also is complaining of visual disturbances. You know, a lot of times in brain issues, if your optic nerve is getting compressed or something is getting damaged, then you may have visual issues also. Headache, vomiting, these are all features of brain. Doctor Saab, this person is having cerebral edema. Cerebral edema. Cerebral edema can happen due to meningitis, example. So, sir, what is the case? सबसे पहले case समझो. There is a case of meningitis. Lumbar puncture was done. LP was performed. Antibiotics was given. That means this is a case of meningitis. Most likely it may have caused edema. So, what are we doing? Until the reports come, we are not going to wait. What are we doing? We are starting empirical treatment, right? Some antibiotics which can kill pretty much all causes of meningitis. Plus, at the same time, what else am I doing? I want to reduce cerebral edema. Now you know the answer hopefully. What is the drug of choice for cerebral edema? Right, the drug is called mannitol. Okay, the drug of choice for cerebral edema, it is called as mannitol. And sir, अब आपको इतना देखना है, where is mannitol working? It's a osmotic class of diuretic. This is the drug that will be working in the PCT and it will be working in the loop of Henle. Are you understanding this? This drug works in both places. But what is the better answer to be chosen? Please remember, this drug works more on the loop of Henle compared to PCT. Okay, so that's what is the correct answer that you're going to choose here. It's not furosemide, loop diuretic, it's not thiazides. See, एक बार revise कर लेते हैं. In the PCT, which diuretics work? Carbonic anhydrase inhibitors like acetazolamide. In the loop of Henle, we have a guy called loop diuretic as well as osmotic. Next, in the DCT, you have thiazides, and in the collecting duct, you have potassium sparing diuretics. Okay, potassium sparing diuretics. So I would go with the answer as B in this. All right, I hope this is clear enough to all of you. The drug is mannitol. That's it. All right. A 35-year-old female has developed incontinence after giving birth to twins. She's been suffering from the same for a few years now, due to which she has developed depression. Which is the best medicine to counter her complaints? All right, my friends, let's go. So, giving you a few seconds to still choose the answer. Okay, so the correct answer to this, it is none other than duloxetine. Doctor, I've told you this during my classes that duloxetine is a class of drugs called SNRI. See, there are two words that you can see here. Sabse pehle, what is the diagnosis? It is stress incontinence. Yes or no? This female is having stress incontinence. That's the diagnosis you should make. After delivering a baby, etc., she is having all this. Now, what happened because of urinating here and there randomly? It may have embarrassed the person, and now she is depressed because of that. So, अब आपको दो चीजें treat करनी है. You need to treat depression also. You need to treat the incontinence also. And the drug from this list which can do both, it is none other than your SNRI, duloxetine. डॉक्टर साहब दो ड्रग्स तो याद रख लेते हैं, डी फॉर duloxetine, डी फॉर decreases urination. This is one. And second is darifenacin also, D for decreases urination. D for duloxetine, D for darifenacin, they both decrease urination. First thing over, right? Answer is this only. Now looking at the other drugs. Okay, sir, fluoxamine is a drug called SSRI. It is a SSRI. You all know SSRIs are drug of choice in depression. Okay, so they are drug of choice for depression, but now you need to treat two things here. You need to treat depression also, and you need to treat incontinence also. SSRIs do not work in incontinence. Okay, next thing is sertraline. It is also a SSRI. We don't use it. Phenelzine, it is a MAO inhibitor. And with MAO inhibitors, you got to remember cheese reaction. Remember, people who are consuming wine or cheese, they may get a severe hypertension called by the name of cheese reaction. What is an example of a MAO inhibitor? It is called as phenelzine. Okay. Next, Fine, doctors. I hope you're ready with your answers. See, once again, this is a question which is more or less just the last line question. This is the actual question. The remaining is just, making up stories to exaggerate this question. Take it. Just anyway, if you have read, you all know that diabetic patients may have complaints like polyuria, polydipsia, polyphagia. So technically, this woman is having polyuria. It's logical enough because her HbA1c's levels are touching the roof. There's supposed to be something below 6.5 for a normal person. It is 12. Each point is like a very high number that is increasing. So 12 is a very high HbA1c. Obviously, she will get urination. And if such high glucose levels are present in this woman, we got to give her insulin. Now we started insulin in this patient. And what does insulin do? Reduces sugar, reduces glucose. What is going to happen if you reduce sugar too much? Hypoglycemia. Now, technically, insulins, if you think, they may cause hypoglycemia, but certain insulins have high risk of hypoglycemia, certain ones have very less risk, almost negligible. So how does this work out, right? So please check this out. Imagine this is a graph I'm drawing from, 0 to 24 hours. That means 24 hours is one day. There are some insulins that will be working throughout the day like this. And there will be some insulins that will be working only for approximately 4 to 5 hours. All right. So now technically, if you look at those insulins which are only working for 5 hours, the amount of insulin coming in your blood all of a sudden is very high. If too much insulin is present in your blood, obviously the risk of hypoglycemia also is very, very high. Are you understanding this? So these insulins which are having high risk of hypoglycemia, they are called as rapid acting insulins. They are rapid acting insulins because you see, the moment I give these drugs, very quickly they are absorbed into your blood. That means they have higher risk of hypoglycemia. They reach a peak. The long acting insulins which are working for one full day, they do not have this risk. These are the long acting insulins. They are called peak-less insulins. They don't have a peak, as you notice. So sir, I'll just give you one hint. One is a short acting insulin. In this, you can simply see the letter S for short. Jisme bhi S hoga, that is a short acting insulin, and that will carry a higher risk of hypoglycemia. Short acting insulins will have higher risk. Glargine is a long acting one. It's a large one. It is a long acting insulin. So which is the safe insulin which does not cause as much risk of hypoglycemia? Glargine is the correct answer. Okay, glargine is the correct answer. I hope everybody understood this question. Okay. By the way, from the oral drugs which we use in diabetes, sulfonylureas have highest risk of hypoglycemia. Sulfonylureas. Okay. Here you go with the next question. A 37-year-old female has been diagnosed with epilepsy for which the patient was put on a medication whose side effect is dilutional hyponatremia. Identify the medication the patient is most likely on. Chaliye, Doctor Saab, I hope you guys are ready with your answers. Okay. Now, you must remember the correct answer for this is a drug called oxcarbamazepine, the cousin brother of carbamazepine. Okay. Now, what is the side effect we are talking about? Dilutional hyponatremia. This is the effect we are talking about, dilutional hyponatremia. So try to understand why does this side effect happen? Because these drugs like oxcarbamazepine and carbamazepine, they increase ADH, anti-diuretic hormone. Look at the word itself, anti-diuretic. It doesn't allow diuresis, so it is saving water. Anti-diuretic hormone will save water, and if it saves water, it will dilute the things inside the body. Are you understanding? In a glass, you're putting, one, spoon of rasna, and you're putting more and more water. Obviously, it will get dilute. Or instead of making 30 ml pack, you're putting only 10 ml, and you're putting only soda. What will happen? It will get dilute. So it's just like that. ADH, if it's increased, the patient will present with dilutional hyponatremia. And please remember, between oxcarbamazepine and carbamazepine, dilutional hyponatremia is more common with oxcarbamazepine. Other side effects are more common with carbamazepine compared to oxcarbamazepine. So itna yaad rakh lena, if they're asking you dilutional hyponatremia, let's say they give both options, carbamazepine also, oxcarbamazepine also, answer is oxcarbamazepine. But if they ask some other side effects of this, then the answer is, carbamazepine. So that's it, Doctor. By the way, look at the other drugs. Valproate. Valproate is generally more or less the drug of choice for many types of seizures. Levetiracetam, a new drug. This L for least teratogenic drug. You got to remember that this is a drug which is considered the drug of choice for treating epilepsy in pregnancy. Pregnancy mein levetiracetam is used. Okay. Phenytoin has quite a lot of side effects that you must be knowing. Okay. So that's all that I will tell you right now. Phenytoin ke side effects hote hain apart from this. Next question. A 53-year-old man presents with icterus. Further investigation reveals elevated alanine aminotransferase. He doesn't drink alcohol. Viral serology turned out to be negative, but he has been on an antiepileptic for the last few years. Which of the following is the patient most likely on? Okay, so the correct answer to this is sodium valproate. First of all, what is the question describing? Okay, person is having icterus. Icterus means jaundice, and the liver enzymes are increased. That means this person must be having liver involvement. Sir, ye banda peeta nahi hai. Alcohol he doesn't drink. Okay, peeta nahi hai, pata nahi jeeta kyun hai. Next, viral serology turned out to be negative. He doesn't even have hepatitis viruses. That means that is also ruled out. Then if the liver is involved, it must be the virtue of some drug, na? Some side effect of the drug is causing this. And you must all be knowing hepatotoxicity is seen with valproate. Okay, you must know that hepatotoxicity is seen with valproate right here. That is the answer. All right. Okay, doctor. What is this case telling us? A person was diagnosed with asthma. Obviously, he must have been put on drugs like salbutamol, etc., which are nothing but beta 2 agonist. Salbutamol, etc., they stimulate beta 2 receptor. So whatever beta 2 will do, all those functions will be stimulated now. The reason we use them in asthma because it produces bronchodilation. But there are other side effects that you will get because of beta 2 stimulation. And what are the other side effects of this? Beta 2 receptor can cause tremors. Okay, so tremor is a side effect of salbutamol. Palpitations are a side effect of salbutamol. Hyperglycemia is also a side effect of salbutamol. What does the beta 2 receptor do is it reduces potassium. It reduces potassium. It causes hypokalemia. It does not cause hyperkalemia. Are you understanding that? This guy reduces potassium. So it's a wrong word. Question ne kya pucha? Least likely to occur. Answer is hyperkalemia. Because bronchodilators like salbutamol, etc., they will all cause hypokalemia and hyperglycemia. Okay, that's it. चलो डॉक्टर साहब ईसीजी देख के डरना नहीं है. It's quite easy answer you can give. Question is not that difficult. Okay. So question, electrician who is admitted in a hospital due to electricity burns. I don't know if you know this, but whenever you get electric burns, especially, you get hyperkalemia. And this person, due to the hyperkalemia, must have developed the arrhythmia, muscle cramps, etc. These are all features of hyperkalemia. Okay, and ECG में दिख रहा है ना, tall T waves. Tall T waves are being highlighted. I've already highlighted that for you. So tall T waves or peak T waves is a feature of hyperkalemia. अब question क्या पूछ रहा है? In this, which of the drug is not used in the treatment of hyperkalemia? Answer is amiloride. Amiloride is a potassium sparing diuretic. It is a potassium sparing diuretic. And what does this guy do? It increases potassium. Patient is already having hyperkalemia. You cannot give potassium sparing diuretics. Okay, so what do we give then? We give the remaining things. First thing we have to do is this person, whenever there is hyperkalemia, we need to protect the heart from arrhythmias. So what are we going to give is calcium gluconate, right? This is a very important drug. See, hyperkalemia management is a part of internal medicine. Here I'm just, giving you insight on this. Calcium gluconate is given as a cardioprotective agent. Next, what do we do is we can give salbutamol. I told you salbutamol is beta 2 agonist, reduces potassium. And insulin is also given. Many of us don't think, sir, insulin is used in diabetes. Why should I use in hyperkalemia? What does insulin do is it takes the potassium from the blood and shifts that potassium into the cells. भाई आपको दिक्कत कहाँ से है? Potassium should not be in your blood. So we are taking the potassium out from the blood and putting it into the tissues. That's all it is. So that's why insulin is also used. Okay, insulin is also used. And dear friends, we can even use diuretics. Diuretics increase the excretion of potassium. Okay, so आपको ये याद रखना है. If you give this treatment, then you can see a good drop in the potassium levels. So you can see big drop. Are you understanding this? If you are going to treat hyperkalemia, that means you want to reduce the potassium. You want to see a big drop in the potassium levels. C say calcium gluconate. B for beta 2 agonist like salbutamol. I for insulin. Insulin plus glucose is given usually. Okay. And D for you have to remember diuretics. D for the diuretics. I hope you are clear with this. So that's just a easy mnemonic. I'm telling you how to remember hyperkalemia. Doctor Saab, I don't care this is asked in exam or not. Tomorrow these are lifesavers. Trust me. Okay. दुआ लगेगी जिंदगी में. We are not just studying this only for the sake of passing this exam. ठीक है, एग्जाम से मत डरो. We will always do something better with our lives. कुछ नहीं हो जाता है कभी. Let's say our luck is bad. Sometimes what we expect may not happen. That doesn't mean it's the end of the world. ठीक है, कुछ हो रहा है आपकी जिंदगी में तो ऊपर वाला कुछ ना कुछ बेटर करेगा. Remember, something good will happen for it. Temporarily, when you are in that bubble, you will not be able to see what it is. But जब हम बाहर आ जाते हैं, you will realize, हाँ यार, what's the big deal? I took one extra attempt. It's okay. All right. So tomorrow, 10 years from now, when you will be in your white apron, wearing the jewelry called, stethoscope, that time, आपको ये दिमाग में नहीं आएगा, I took 2 attempts, 3 attempts. That day, each day, when the patients are appreciating your efforts, you will realize that जो हुआ अच्छा हुआ, कोई बात, थोड़ा टाइम लग गया तो क्या हो गया. ठीक है, तो टेंशन मत लो, पढ़ने के लिए पढ़ो, नॉट जस्ट फॉर द सेक ऑफ पासिंग द एग्जाम. ये मेंटालिटी हमें कहीं नहीं लेके जाएगी. ऑलवेज स्टडिंग ओनली इंपॉर्टेंट MCQ, ओनली थिंग्स लाइक दिस विल नॉट टेक अस एनीवेयर. ठीक है, देखो मैं तो आप लोग को हर टाइम क्लास में भी डॉक्टर साहब ही बुलाता हूँ बिकॉज यू डिजर्व टू बी कॉल दैट. ओके, यू हैव पास्ड योर एग्जाम्स वॉट एवर इट माइट बी अब्रॉड, यू हैव योर डिग्रीज, यू आर ऑलरेडी अ डॉक्टर टू मी. ये एक जस्ट स्पीड ब्रेकर है. स्पीड ब्रेकर कम्स इन बिटवीन, दैट डजंट मीन योर जर्नी हैज स्टॉप्ड. आप गाड़ी रोक के बैठ जाते हो क्या स्पीड ब्रेकर आने पे? व्हाट डू? यू जस्ट स्लो डाउन, देन यू गो. सेम थिंग, एग्जाम इज नथिंग बट जस्ट अ स्पीड ब्रेकर. होके चला जाएगा, टेंशन ना लो, बस स्टडी वेल, दैट्स ऑल इट इज. गिव योर बेस्ट, बी ऑनेस्ट. यू शुड हैव दैट थिंग इन योर हार्ट के आई डिजर्व टू पास. ठीक है, आई नो दिस में साउंड हार्श, बट मैं हमेशा ये कहता हूँ कि भाई भीख मांग के पास नहीं होना है कि बस एग्जाम इजी आ जाए तो आई विल पास. Say that I will pass the exam irrespective how the examiner put the exam. Then that means that day you will not only pass, you will respect yourself. अपने लिए खुद से respect आएगी and you will be confident in life to do a lot more things coming forward. ठीक है, वरना ये हमेशा ऐसे ही रहेगा. एज पे अगर पास होंगे ऐसे ही रहेंगे ना, तो अपना ऐसा ही होता है कि अपना कैलिबर ही इतना है. योर मेंटालिटी विल बी stuck over there. So don't do that, my friends. This is the starting of your lives. You will do much better. Until you do something, you don't know how much you are worth, and you are worth much more. Pass your exam. We are all with you. We are all with you. ठीक है, कुछ ना कुछ कर ही लेंगे. I know a lot of deviations related to internship etc. must be coming in your heads right now. गोली मारो सबको. It's okay. जो भी प्रॉब्लम्स है आएंगी जाएंगी, बट रिमेंबर द टाइटल दैट यू गॉट कॉल्ड डॉक्टर विल रिमेन फॉर एवर. ठीक है, अपना देश है, छीन के लेंगे चाहे जितना कुछ भी हो जाए, दैट्स योर राइट. ठीक है, अर्लियर ऑल्सो रिसेंटली आई पुट अ पोस्ट, भाई हम तो इंडियन सिटीजन है, जो भी भेदभाव हमारे साथ होता है देख लेंगे, वट एवर इट मे बी. राइट, अभी पढ़ लेते हैं. राइट, डू नॉट get deviated by this. सर उठा के पास होना है. Don't let anybody tell you. कल को ये बोला जाएगा कि easy exam है, पास कर लिया, आप लोग की knowledge कम है. So that's why let them make whatever the type of exam they make. We will pass according to them. ठीक है, so that's it. Next, let's move on. So we got this. Something to learn from ECG right here. जिंदगी कभी भी ऐसी ही होनी चाहिए. If this is how your life looks like, then you're dead, my friends. Life is always about ups and downs only. तभी आप जिंदा हो. Okay. So here we go. Next question. A patient presented to the clinic with complaints of red, swollen, big toe. Lab investigation shows that the patient is suffering from hyperuricemia. All of the following can reduce uric acid except. Alrighty, so I hope you guys are ready with your answer. The answer to this question is hydrochlorothiazide. Thiazides. ठीक है, क्वेश्चन ने क्या पूछा? All of them can reduce uric acid except. Sir, if you see, I haven't put very familiar options once again to teach you something here. I'm not here to please you. I'm here to uplift you. So, sir, fibuxostat, allopurinol or fibuxostat, they are xanthine oxidase inhibitors. They reduce uric acid. They reduce the production of uric acid. Okay, first thing is this. Next, sir, lesinurad. Lesinurad, ये drug less करती है uric acid को. Okay, lesinurad lessens the uric acid. This is the next thing. Next, losartan. Losartan lowers uric acid. Losartan lowers uric acid. These are the three drugs I said. Okay. Hydrochlorothiazide is a diuretic that actually has a side effect, hyperuricemia. It can increase uric acid. Are you understanding that? So this is a drug that can actually increase uric acid. That's the side effect of this drug, hyperuricemia. So I hope this is all clear. The correct answer is thiazides. Fine. Which of the following is the incorrect mismatch? All right, Dr. Sahab. So, if you're talking about the antibiotics, you got to know from this options, this is the incorrect mismatch. Sergi, I'll teach you the concept. Technically, this is a thing that links to your microbiology. Guys, know that Mycoplasma is that bacteria that doesn't have a cell wall. इसके पास cell wall नहीं होता. If it doesn't have a cell wall, obviously the medicines which are called cell wall inhibitors will not work. So अब आपको ये जानना होगा which drugs are called cell wall inhibitors. Okay. See, there are two types of cell wall inhibitors. One is called beta-lactams and another is called glycopeptides. Example of which is vancomycin. Vancomycin is a glycopeptide and beta-lactams are drugs like penicillins. I'm just writing their patterns. Penicillins, cephalosporins that has ceph in the name, penems, carbapenems, and one more drug called aztreonam. Aztreonam. So penicillin, cephalosporin, penems, aztreonam is not that important, so I'm just removing it from here. Although it has one importance, aztreonam is the only beta-lactam which can be used if you have penicillin allergy. If you have penicillin allergy, you cannot use cephalosporin and penems, but aztreonam is the only one we can use. Apart from that, okay, let's keep it aside for now. तब क्वेश्चन क्या बोल रहा है? Mycoplasma के पास cell wall नहीं है, does not have the cell wall, so technically the drugs which are in front of you cannot be used. Cannot be used. So which drugs are used for mycoplasma? Mycoplasma is a pneumonia. That means it causes a disease called pneumonia, and you got to remember that for respiratory tract infections, macrolides are very good drugs. Macrolides are the drugs called romycins. Romycin. Sergi, vancomycin also has a mycin, not that. Romycin, azithromycin, erythromycin, like that. I hope everybody got this idea. Baki to they're all correct, whatever the antibiotics are given over here. Anyway, in my group, I'll be sharing one small list of antibiotics which are drug of choice for certain infections. Hopefully, you guys are already in my channels. So anyway, I'll be sharing that on my Insta and here and there. Okay. So next, moving on. A 32-year-old female presents to the clinic with history of 17 days of fever. Now, since last 2 days, she has pain and burning sensation while she pees, and her urinary frequency has also increased. She was using NSAIDs to reduce fever. Which group of drugs is most effective for the healing of NSAID-induced gastric ulcer? All right. Sir, the correct answer to this question, it is option C. ठीक है. अब सबसे पहले ये समझ लो, whenever there is a ulcer, peptic ulcer disease, whenever there is a ulcer, the pain that you get is due to acid. Pain that you get is due to acid. Please remember, acid is the guy that produces pain. So our first priority always whenever you're treating peptic ulcer disease is to reduce the acid so that you can reduce the pain in the peptic ulcer. And the best medicines always to reduce acid are none other than your PPIs. Now go behind the pathology. होता क्यों है peptic ulcer disease? There are two reasons why the peptic ulcer disease would happen. One is due to a bacteria called H. pylori and due to certain drugs called NSAIDs. Doctors, what do NSAIDs do? NSAIDs reduce prostaglandins because of which the ulcer happens. ठीक है, ये तो भाई कीड़ा मकोड़ा अपना बैक्टीरिया है. Obviously, H. pylori will be killed by antibiotics. There is something you must have heard called triple regimen. In triple regimen, there are 2 antibiotics and 1 PPI. 2 antibiotics plus 1 PPI. So that's it. H. pylori would be killed like that. If you talk about the NSAIDs now, NSAIDs, how do they cause ulcer? They reduce prostaglandins. So भाई अगर आपको H. pylori or NSAID induced ulcer पूछे क्या how to treat the pain, answer is PPI, best drugs to reduce acid. But assume the question was little different. Instead of asking most effective, if they asked most specific treatment of NSAID induced ulcer, question has changed now. Specific agar word पूछता है, then you will say the answer as prostaglandins. Prostaglandins. Doc Saab, why prostaglandins? Please pay attention. NSAIDs, they reduce prostaglandin because of which the ulcer happened. So what do you want to do in the treatment? Increase the prostaglandins back again. Then we give a drug called misoprostol. Misoprostol. Okay? Always remember this, what I'm telling you. Prostaglandins. Prostaglandins. You see, they are telling you always we are pro stomach. They are pro stomach. Unke naam mein hai. We are your friends. We protect you from peptic ulcer disease. So if you reduce prostaglandins, now the problem will happen. So what is the drug I can give if they ask specific? Specific my answer is misoprostol, but if they ask most effective, answer is PPI. Do not make this blunder in the exam, reminding you just 1 month before this. ठीक है, तो ये वीडियो को बाद में भी एक बार 2x स्पीड पे just fast forward and check. In fact, I advise, it's my strong advice, watch previous videos of mine also and go. Trust me, उसमें से अच्छे खासे आपके important चीजें हो जाएंगी and God willing, you will see a lot of things in your exam. ठीक है? So now that we are done with this, let's move on. The patient presented with the chest discomfort, nausea, flushing, dizziness, and the throbbing headache. On taking history, he informed that he was undergoing treatment for a diarrhea and he drank alcohol as he has taken leave from his office due to sickness. ठीक है? This reaction to alcohol is not seen with. सो हुआ क्या, पेशेंट को बीमारी हुई है और उन्होंने छुट्टी पे दारू पी ली। बीमारी आए पर मौज ना कम हो जाए। सो टेक्निकली first you need to diagnose all these things, the symptoms that I have given there. It is showing you a reaction called disulfiram reaction. Disulfiram reaction. Okay. Now, whatever happens in disulfiram reaction, I have explained in my previous videos in 25. देखना उसको. Anyway, I want you to see them. ठीक है. Disulfiram reaction. ठीक है. और डॉक्टर साहब खाली देखना नहीं है, डोंट जस्ट वॉच द वीडियोस, ऑलराइट, व्हेन यू सी देम इन योर एग्जाम, सो मेनी क्वेश्चंस आर कमिंग फ्रॉम दीज, एक्सप्रेस योर हैप्पीनेस। हमारी भी हौसला अफजाई करो भाई, वी आर ऑल्सो वर्किंग हार्ड सो दैट यू गाइज डू द बेस्ट, सो म्यूचुअल अंडरस्टैंडिंग, कॉमेंट में थोड़ा प्यार दिखाओ, ऑलराइट, सो वी ऑल्सो फील के भाई हाँ, वी आर ऑल्सो डूइंग समथिंग दैट इज better for everybody. So disulfiram reaction. So technically you must know that disulfiram is a drug that was created to stop drinking. I told you it's like a punishment drug. If you drink alcohol when you're taking disulfiram, you will fall sick. So technically you should not drink when you're taking disulfiram. All right. So sir, there are some guys that shows this kind of reaction, and I always teach you this mnemonic if you remember. Most common cause, MCC. ये 3 drugs, if you're taking, don't drink alcohol that time. So what is the drug that is outside this list? Amoxicillin. Question asked, which one is not seen right here? Which one is not seen here? Okay. So now that you got this, let's move on, sir. A urologist is teaching new interns about the drugs used to control urination. Which of the following drug is not used for overactive bladder? Okay, which of these are not used for overactive bladder? Overactive bladder. Sir, remember I told you there is a drug called darifenacin. Darifenacin decreases urination, so it will be used in overactive bladder. Trospium, there is a mnemonic in our notes, soft detrusor. These are drugs that come under that. Mirabegron or Vibegron, these are beta-3 agonist that will reduce urination. These are muscarinic blockers that will reduce urination. Bethanechol is a muscarinic agonist. Bethanechol increases urination. That's why it is used when you have urinary retention. Bethanechol is used in urinary retention. I hope you understand. B for bethanechol, urination बढ़ाता है. Bethanechol increases urination. Other guys, they reduce urination. Okay, so that's it. Question asks, which one is not used? The answer is bethanechol. Bethanechol is not used. All right, next question. A patient diagnosed with rheumatoid arthritis was on medications. After 2 years, he developed blurring of vision and was found to have corneal opacity. Which drug is most likely to cause this? So you got to know the answer to this is chloroquine or hydroxychloroquine. Okay, so technically some drugs of malaria are also used in rheumatoid arthritis. If you look at the word quin drugs are usually used in malaria, right? So chloroquine, hydroxychloroquine, these are also used in Rheumatoid arthritis. All right. So you must know that chloroquine drug, if you use it for long time, then there is a risk of one side effect, bull's eye maculopathy. Okay, bull's eye maculopathy bolte hain. So you got to remember this. This is a very special side effect of hydroxychloroquine. I mean the chloroquine. Now another thing you have to remember, a very special point. It is a drug which has very high volume of distribution. अब उसकी कहानी में नहीं जाते हैं, the details. Just remember that chloroquine is a drug that has very high volume of distribution. Remaining all drugs are also part of the spectrum of rheumatoid arthritis treatment. See, generally we use the drug called methotrexate as the preferred drug for treating rheumatoid arthritis, and if required we'll be adding some treatment called HCQS. HCQ is a short form for hydroxychloroquine. S stands for sulfasalazine. Sulfasalazine. So this is a combination that is added in the treatment. All right, sir. A 27-year-old female presents with intense, sudden pain in the upper right part of the abdomen that worsens with deep breaths. She also has nausea, vomiting, fever, and jaundice. Ultrasound findings show a stone in the biliary tree and cholecystitis was diagnosed. Intern gave a painkiller and the pain worsened. Which is the most likely injection that was given? Okay. It's a straightforward thing. By now you should have caught this. Morphine is the correct answer. Morphine is a opioid drug. Please remember that already I have given you a case scenario of cholecystitis. Doctor साहब, ये जो questions आप पढ़ रहे हो ना, the questions I frame always is such that you're learning diagnosis of diseases which will help you with other subjects also. So that's why read the questions well. उसके अंदर मैं एक एक word देख समझ के डालता हूँ, diagnostic test etc etc. So sir, cholecystitis diagnosis, you are seeing all the things that I mentioned there. Fine. So why shouldn't I give this? Because opioids causes contraction in the sphincter of Oddi. Are you understanding this? They cause the contraction in that, and that will increase the pressure. That will increase the pressure, biliary pressure. That's the reason we should avoid morphine whenever somebody has biliary colic. Cholecystitis presents with something called biliary colic, and that's where these drugs are contraindicated. ठीक है? So obviously surgery का important topic है ये. You got to know this. So here we go. We are done with this section. Opioids are avoided. Let's say I ask you, some intern made a mistake. Doc Saab, how will you rectify this? You should say, sir, we will give naloxone. Naloxone is the antidote of opioids. How does morphine work? Morphine works by stimulating mu receptor, which is causing the problem now. How will you treat it? You will block mu receptor by a drug called as naloxone. Naloxone. ठीक है? बाकी सब भी pain killers है. All of them are pain killers, but opioids are avoided. What is the remaining drugs? Remaining drugs are NSAIDs. You can give NSAIDs, no issue. Okay. Hope everybody is comfortable with this question. A 57-year-old patient who is a known case of BPD is undergoing lithium therapy. He was recently diagnosed with hypertension, following which the patient was started on the respective medication. Now the patient lithium serum levels are 1.7 milliequivalents per liter. Which of the following drugs must have caused this? हाँ जी डॉक्टर साहब, डाइक्लोफेनाक is also available IV. Okay, so correct answer, sir. This will be thiazides. Please know that lithium is a very hot topic for your examination, let it be side effects or drug interactions. So lithium ke side effects in our notes are already there with the mnemonic. Please revise that. And apart from this, one interaction I'm telling you, thiazides are those drugs that will increase the reabsorption of lithium. Okay, reabsorption means lithium is going out from the body, but they will stop it and bring it back. Thiazides will increase the reabsorption, hence they will cause toxicity, lithium toxicity. Very important thing, you got to remember this guy, that is it causes Epstein's anomaly. Remember, this lithium is the guy that causes Epstein's anomaly. Next, a 62-year-old woman who is a severe case of osteoarthritis is advised for the knee replacement surgery. On the day of surgery, she was given halothane. After some time, she developed a very high heart rate and her temperature is 41 degrees, whatever. What is the management of this situation? Okay. The correct answer for this is dantrolene. सबसे पहले let's diagnose what is the problem. Sir, halothane was given. Do you guys know, you must have studied in anesthesia, or it's there in my notes also. Halothane and succinylcholine. Halothane and succinylcholine. These two drugs, they cause one problem called malignant hyperthermia. Okay, malignant hyperthermia. So what is happening here is contractions of muscles. See, whenever we go into some cold weather, have you noticed by instinct we start shivering like this? Because shivering causes muscle contractions, increasing the body temperature. अब यहाँ पर कुछ हो रहा है ऐसा ही. In your muscles, there are some receptors or channels called ryanodine receptors. Ryanodine receptors. They are involved in contractions. Okay, they are involved in the contractions. Now there is overactivity of ryanodine receptors. So that is what is malignant hyperthermia. There is contractions happening again and again, which is increasing your body temperature. So that's it, that's malignant hyperthermia. Similar problem is there in something called neuroleptic malignant syndrome. Neuroleptic malignant syndrome, which is EPS, extrapyramidal side effect. It is a part of your antipsychotics. And please remember, antipsychotics के side effects are super high. EPS. Last video also 25 important में मैंने डाला था EPS का exact question, ditto question was there in your exam. I told you there is a image based question also. Somebody got this torticollis after starting a medicine. Which medicine can do that? Haloperidol, etc. can do that. Then what is the treatment to be given? Benzhexol, benztropine. Last FMG exam they have asked what is the treatment of that. मैं बैठ के बातें तो नहीं बता रहा, you can go check this out. This was there. So that's why it's my humble request to everyone, please videos देख के जाओ, you will not repent it. Sir, कोशिश हमारा काम है, I cannot promise anything, but when we are sitting based on our experience, हम लोग ये बनाते हैं आपके लिए, तो it's your obligation to watch this and go. All right, fast forward करके देखना. That's it. So dantrolene is the drug given for NMS, neuroleptic malignant syndrome, as well as malignant hyperthermia. Okay, so दोनों जगह. सक्सिनाइलकोलिन तो उल्टा ये करता है. Malignant hypothermia is caused by सक्सिनाइलकोलिन and halothane. Okay, so done, sir. Next, a 42-year-old female having toxic follicular adenoma presents to the ED with a heart rate of 160 beats per minute, temperatures whatever, severe anxiety and vomiting. She's also having history of diabetes type 2 and asthma. Which of the following is the best management in the treatment? So learn to diagnose diseases also in your head. If you already know the answer, great. I'm happy, but I'll be double happy if you know the diagnosis in the head. Follicular adenoma, toxic follicular adenoma might be releasing too much thyroid hormones. And if too much thyroid hormone is released, you get thyroid storm or thyrotoxicosis. So, Doc Saab, in this situation, what do you give? You have to give PTU. PTU is the drug of choice. PTU is the drug of choice. Usually in the treatment, we give two drugs. PTU plus propranolol is given. But please remember, this person has asthma. So it's better to stay away from propranolol. Okay? Propranolol is a beta blocker. Once again, another question, beta blockers are avoided in asthma. ये भी question case में था अपने, and that was asked in last exam. Alright, so asthma, beta blockers are avoided. Anyway, I just asked you best management. Best is PTU. Alright, I hope everybody is okay. Methimazole, carbimazole, these are the drug of choice for hypothyroidism, avoided in the first trimester of pregnancy. Who's the drug of choice in first trimester? PTU. Okay. Next, a 79-year-old retired teacher is seeking for your opinion regarding his memory. He complains of difficulty remembering recent events, disorientation, mood swings, language problems. MRI shows degeneration in the brain, especially in the hippocampus. The patient's LFT are also abnormal. Which of the following is usually avoided from these drugs? Okay, so the correct answer, it is going to be tacrine. Doc tacrine is toxic to liver. It is hepatotoxic drug. In the question I've already given, LFTs are abnormal. Sir, hippocampus, some problem. Obviously, you must have figured by now they're talking about Alzheimer disease. So in Alzheimer, tacrine has to be avoided. It is a hepatotoxic drug. Next, rivastigmine is a drug given in the form of a patch. It's given in the form of a patch. Donepezil is the drug of choice. It is the drug of choice. Galantamine is another drug we use. Okay, all these drugs are nothing but your drugs that we use in Alzheimer. चलो एक लेटेस्ट अपडेट भी सीख लेते हैं. Let's learn something. You all know the reason why Alzheimer happens is due to deposition of some guy called beta amyloid. Okay, beta amyloid. This guy is the bad guy. Beta amyloid is the bad guy. So what do we want to do? We want to reduce this bad guy. And now we have a new drug called as edacanumab. Okay, edacanumab. अपन इसको ऐसे याद रख लेंगे, AD for Alzheimer disease. Alzheimer disease. This is the guy that is the new drug for Alzheimer disease, edacanumab. Okay, so some things I have given you which are new treatments also. We have learned some monoclonals, etc. ठीक है guys, so more or less we are done with our short and sweet session. I don't want to take more of your time also. ठीक है अच्छे से, because I finished this session faster, आराम से, मतलब whatever we needed to do we have covered. Please spend some time, if you can, watch the previous videos also today itself. बाद में फिर टाइम नहीं मिलेगा, you will be busy with something else. Since you have anyway spent some time, imagine this session was for 3-4 hours, same like that you can spend 1 hour on the previous 2 videos, watch them at 2x speed. उसमें वही topics, some things that will be covered that will definitely be beneficial for you. Once you have listened to all these things, right, this is the place we are learning to mark the MCQs correct, and then when you revise certain topics it will make much more better sense. तो इसको अच्छे से कर लेना है सर. Now I don't want my comment section after the video is uploaded PDF sir. उसके बदले I want my love. All right, so that's what I am waiting for, and wishing you all the best, my friends. Take care of yourselves. Once again, a quick reminder, exam ही है. Don't make a fuss about this. We will all do this. And remember, I told you something. We will level up and do this. You're already there. This is tough for anybody. Let it be any graduate from anywhere. You're doing a big thing. That's why when you deserve to pass, when you have done the hard work, that credit goes to you, right? So आराम से कर लेंगे. Don't think too much. Whatever you can, do the best. Ups and downs. Some days you're not studying, some days you don't feel like studying. Okay, so technically it's all right. जो भी होता है whatever देख लेंगे आराम से. Done? So take care of yourselves. I will be in touch, whatever it is, through my Instagram, Telegram, etc. You can message me your queries. I will be more than happy to respond to you. Okay, so God bless you everybody. Take care. Bye everyone.